Hi, this is Dr. Barbara Howard, here to tell you about how CHADIS can help with remote ADHD care. CHADIS is a clinical process support system, and it's called that because it helps with all aspects of a visit, including remote visits, with pre-visit data collection from a choice of over 600 tools to the moment of care decision support for clinicians, including showing them scored results and graphic displays, and a special feature valuable for ADHD called a patient-specific template, and the ability to coordinate care and eFax referrals. And then after the visit, individual patients get individual web pages called care portals, where they can receive notes from the visit and resources. CHADIS allows for scheduling, monitoring questionnaires between visits with reminders to do that, and patients have access to patient-specific national and local resources. Clinicians can also earn MOC Part 4 and see other kinds of decision support. This is a graphic of that scenario. Here's the parent doing questionnaires from home, the teen on their own login, results going to the doctor, sharing information with teachers, psychologists, etc., and information going to the care portal, MOC credit, and extra billing income, whether it's done by televisit or in person. CHADIS is actually perfect for televisit because information is being collected from home. This allows you to triage for who needs an earlier visit or an in-person visit based on their symptoms. It's possible to improve your attendance by having no appointments given until all the questionnaires have been completed. This facilitates visit documentation and reduces no-shows. Documentation is created for a report, and emails can be sent either by parents or by the office staff to request input from teachers and other caregivers that appears along with the parents' input and the teen's input in the report. The clinicians then can put in free text, share graphics over teleconference, and send handouts to the care portal, including a developmental curriculum for young children and private access for teenagers. Clinicians can send notes from the visit and also schedule questionnaires to be done at any interval, in addition to e-faxing referrals directly from within CHADIS. So ADHD involves a lot of steps: triage, screening, diagnosis, shared decision-making, monitoring, patient education, the ability to work with an integrated behavioral health provider, care coordination, and possibly maintenance of certification research, and everybody is interested in additional revenue. So as a sample for triage, a developmental intake questionnaire is available, actually several that you can choose from. Pregnancy and perinatal history, developmental history, child medical history, family history are all available. And then for the specific aspects of ADHD care, these are some of the things that are recommended and that we're all used to doing for ADHD: asking about patient goals, assessing development, especially in younger children, emotional development, assessed in younger children by questionnaires of this kind, mental health questionnaires in older children. CHADIS supports the obtaining information about the child's strengths, and then standardized checklists for ADHD symptoms such as the Vanderbilt, the Connors, and the CBCL. We have questionnaires about medication side effects, sleep, internet use, or even addiction, substance use, and then comorbid conditions in the mental health range can be screened for or determined by diagnostic tools. These are depressive symptoms, anxiety symptoms, and general screeners. There are also autism-specific tools, which are very useful as screeners because that's often in the differential diagnosis for ADHD. And social determinants of health are often important too. Teachers can provide input on tools that parallel these, the Vanderbilt, Connors, CBCL, School Intervention Questionnaire, the Cadre Teacher Report, which breaks out specific areas of learning and success, and autism tools. And then diagnostic tools are also available. These overlap somewhat in terms of being called diagnostic or screeners. So parents and teens can complete the CBCL, a DSM-5 modules that provide DSM-5 diagnoses for ADHD, anxiety, depression, and conduct. For younger children, following the DC 0 to 3 R guidelines. For autism, the checklist for autism spectrum disorders and CARS, general mental health with the WICE, sleep habits, developmental coordination disorder questionnaires, and a general functional symptom record. For the clinicians, These are tools completed by the clinician, include the clinician CARS, the checklist for autism spectrum disorders, the DIPA for young child mental health, and the mini kit for older child mental health. So how does it work? Well, your office decides on which questionnaires you want for which type of visit. So you may have an ADHD initial visit, an ADHD follow-up visit. You select which ones you want to set up for that visit in CHADIS. Patients who are at practices where there's an integration can log in through the EHR portal to complete tools. Freestanding offices invite the patient to do questionnaires either at the time they make an appointment, by sending them an email, or sending them a letter to register, all is with one simple invitation code. If they were being seen in person and have not enrolled before, there's a quick enroll function that can be done on any internet connected to tablets, including $75 tablets. The patients then, after registering themselves and establishing a username and password, complete auto-assigned questionnaires, and the clinicians see the results instantly. So that's the basic idea. They can use any kind of internet-connected device, including a smartphone. Most people prefer a tablet if they have one, or if you're using one in the waiting room, but remotely they'll use whatever they have at home. They see the questionnaires true to the form of the tools. Here's the PHQ-9. They simply click the radio buttons to give their answers. It can also be done one screen at a time, like this, and if they click up here for Spanish, they can then see the questions in Spanish. The results come back to the doctor in English. Now, for telehealth, you'll be seeing the patient remotely, but you'll have all of this data available to you, as well as a place to put your notes. Each questionnaire can be seen in its entirety with questions and answers. It also creates a summary, which then can be printed out, as you can see here at the top, or put into a format where you can make edits to the report that has been generated automatically by CHADIS. Now, the patient-specific template is a way to help you with your documentation for a comprehensive ADHD visit. The questionnaires pre-populate the template, and the template presents the results and interview results options within the guidelines. There's decision support, including access to the Vanderbilts from all respondents, and it automatically creates 504 plan requests and IEP requests. An auto text report is created, and information appears in each child's care portal or can be printed out. The patient-specific template also documents that you've done evidence-based care as required for value-based payments, and you can have the data in any form you want by custom reports. This also forms a research database for you. Keep in mind that CHADIS can program any custom questionnaire you want. So here's an example of a report that actually hasn't even been started yet by the doctor. Dr. Jones was the referring doctor. You can see the report already created over here before the doctor has entered anything. You can click here to get the Vanderbilt graphic results by the parent and the teacher, including the dose of medicine the child was on as reported by the parent. Green is good, red is bad. Any reds or yellows that float above this line are then significant for this domain of inattentive or hyperactive symptoms. Similarly, yellow and red are significant for the impact aspects of the Vanderbilt. Other kinds of information is collected and followed over time. So these are goals from the last visit that appear. Documentation is made easier by having some pop-up boxes where you can make selections of text, but you can always choose one of these pencils and add text. Here is the results of the social history, family and cardiac history, and other things that are collected include past medication use from child medical history, family cardiac history, Vanderbilt that includes medication dose and side effects. We even have the abnormal involuntary movement scale if you're prescribing something where that's relevant. And there's a medication table with notes and suggestions. For treatment for behavior, there are educational handouts, resources, and goals for change tracked over time. And to collaborate with schools, as I mentioned, there are Vanderbilts and Connors, but also these letters available to be printed. So here's an example of the medication table. Now, if you're an expert at taking care of ADHD, that's great. But even if you're not, these are hints that are valuable to you in choosing the medication and the doses of medication, in what forms the medication comes, is also present. Here's an example of a populated 504 plan letter. And CHADIS, in the end, assembles all the information into a care plan like this that would be adequate for payment by insurance companies, and also as a printable report to copy paste into your electronic health record or to mail back to a referring doctor. You can even enter notes that go specifically to the patient's care portal right here on the care portal tab in the patient-specific template. And some educational materials are generated automatically by the selections you made or the selections the parent made. So here, the parent had a goal about better relationships with other children, and a customized handout has been created here. By checking or unchecking this box, the doctor can choose whether this will go to the care portal or not. So here's an example of a care portal for an older child, which is also a place they could provide journaling. And then on these tabs, these other resources appear. So here we are in the Visit Notes tab. This is a note from today's visit, and when they click on it, they will see that note that I showed you being made by the doctor. In addition, there's resources, some assigned by the doctor, others assigned automatically. We have many resources for ADHD care and care of ADHD comorbidities. There can be text for teens in the resources. Here's an example about dealing with sleep for teens. There are examples of handouts for parents. Here's a discipline handout, and resources like community agencies and websites are present there. Of course, doctors and patients can both also search by putting in some words here to find a resource and then selecting it to save for their reference later. Here's an example on a depression handout for teens. The referral functionality allows either verbal consent or written consent within CHADIS to then be e-faxed to your choice of locations. And there's a link right here that makes that possible, for example, for a referral to an infant and toddler program because of a failed developmental screen. Hopefully they're referring to you, the specialist in DBP. You can have a registry of any kind of registry of information that's stored in CHADIS. In this case, it's all the positive ASQs, but it could be all of the Vanderbilts over a certain score, for example. Clinician Education is built into CHADIS with e-chapters, AAP guidelines and hints, and a link to the National Library of Medicine. You can earn 25 MOC Part 4 credits for attending 3 webinars to review the use of the ADHD PST, but no chart review is required of you to earn that. That's also 60 CME credits. And don't forget that you can schedule or on an ad hoc basis assign questionnaires to the patient. The patient will get a text message or email reminder to do them until they've actually completed them. This also allows you to update treatment plans remotely within the care portal and share data with other professionals. CHADIS automatically creates graphic displays of results at your request for your research project or your quality improvement project. Custom forms and questionnaires can be created for research projects, including an online consent form that has been found in our research to be acceptable to the IRB. And again, patients are getting reminders until tools are complete, helping you avoid the work of a lot of research assistants. You can get that kind of information between visits and at the conclusion of your study, and get data dumps of your data at any point. Of course, there are billing codes that are relevant to this kind of care that can generate additional income, which is particularly important if you're conducting this by telehealth. The complete CHADIS package includes everything that I described. There are a few a la carte proprietary questionnaires, but we have plenty of open source questionnaires to satisfy your needs. Please let me know if you have questions or you'd be interested in signing up for CHADIS. It's a perfect time in the interest of telehealth. You can email me at bhoward@chadis.com, or for general information, info@chadis.com. Thank you.
Very good.